So it gives me great pleasure to introduce our keynote speaker, the Honorable Gale Brewer. Having lived in New York my entire life, I've watched her actions from the time that she started out with Ruth Messinger down to when she was Manhattan Borough President. Now she's city council member, and you can read what's in our booklet about her. But I have personal experience. I was on Community Board 11, Spanish Harlem Community Board, for 5 years. And whenever we needed anything, she was there. Didn't matter how big or how small. And if you've lost faith in politics, Gale Brewer will make you regain your faith. So, Gale Brewer, please.
Thank you very much, Dr. Flores. Being on a community board is the hardest job in America. So congratulations for 5 years. That's amazing. So I'm really honored to be here. It's a beautiful day out. I've had 5 events so far because children are out, parents are out. We had the garden events, but it's really, really nice to be here on such an important topic. The 20th Annual International Asbestos Awareness and Prevention Conference. Thank you, Linda Reinstein, for the work that you're doing for the Asbestos Disease Awareness Organization. And thank you, everybody, for being here. I think we all know that just 2 days ago, our city and our nation paused to remember the I think it was over 3,000 lives lost on September 11, 2001. You may not remember, but that was election day for many of us. That was the first time I ran for election. It was probably the election, people had to vote. It was also the first day of public schools, and a lot of people were doing those 2 activities, and thank God we're not at the World Trade Center. So it's a day that we remember on so many different levels. Remember the thousands who died, not from collapsing towers, but from toxic exposures in the days, months, and years that followed, as we are today remembering. Remember the first responders, recovery workers, residents, and children who breathed in that poisonous air. We are still thinking of them. And I think particularly because when I was borough president, I always went to the World Trade Center site, and it's very moving. You never forget the dong of the bell. Every single time, at one point, children and now grandchildren and probably great-grandchildren are talking and remembering based on their family dying at the World Trade Center. Very, very moving. But this Thursday, as I always do, I attended the 9/11 memorial ceremony at the New York City Fire Museum in the West Village. It's about a mile from Ground Zero. Some of you may have been there. It's a wonderful museum. Not so long ago, the building next door collapsed on top of the museum, and so they had to rebuild. And they have rebuilt. It's going to be open to the public in October. They did a great job rebuilding. The dust that blanketed Lower Manhattan on 9/11 was more than twisted steel, as you know. It was a toxic cloud of 400 or more tons of pulverized concrete, lead, dioxins, and asbestos. 24 years later, the number of deaths from exposure exceeds the toll from the attacks themselves. Every single member of the fire department yesterday, on the 11th, 2 days ago, particularly the commissioner, had a bracelet that said 343, which of course is the number of firefighters who died that day. And he told us, well, you probably already know, that 3 have died, at least 3 every single month since. And totally, fire and others, 45,000 people are supposed to die. As somebody who didn't work in the area, I knew a couple people who died that day, but I have known so many who have died since. Particularly because I've often worked at 1 Center Street or in the Surrogates building or around City Hall. So I can give you some very, very close friends who have died since. When Cuomo was governor, to his credit, he did, with my pushing and others, put I call them the rocks. There are some rocks with steel trimming on the memorial site, and they are in memory of those who have died since 9/11. That was my pushing because I wanted the families to know that in addition to those who died, there is memorial for those who have died since. That means a lot to me. Let me just, one more thing I wanted to say. I think you know better than I, asbestos is not a problem of the past or a relic of the industrial age. It is very real. There is no safe level of asbestos exposure, not in homes, not in schools, not on construction sites, and certainly not on our streets after disaster. And I think because of your efforts and others, there's been big pushes around the country, but particularly in New York, every single construction site has protocol on asbestos. I hope they all follow it. I don't know that they do. But the science is indisputable. Even microscopic fibers can remain in the lungs for decades, which can cause deadly diseases. Each preventable death from asbestos is a failure to protect those we serve. The Center for Disease Control's 9/11 World Trade Center Health Program has since 2018 maintained an inventory of over 350 chemical, physical, biological, and other hazards, termed 9/11 agents, faced by the approximately 400,000 first responders, recovery workers, and those who commuted or lived in the neighborhoods near the attack. Health professionals and first responders publicly raised concerns about health effects from exposure to 9/11 agents as early as October 11, 2001, as everybody in this audience knows. However, we all know public officials, particularly the federal ones, including the then chief of the Environmental Protection Agency, assured members of the public that it was safe to return to the area near Ground Zero, despite mounting evidence to the contrary. In September 2023, 9/11 Health Watch, an amazing organization, very small in terms of staff, very mighty in terms of their efforts, an advocacy organization for those affected by illnesses related to the attacks, filed a Freedom of Information request seeking records that could shed the light on what the mayoral administrations of Mayor Rudolph Giuliani and Mayor Michael Bloomberg knew about 9/11 agents, contamination of Lower Manhattan, and ongoing risks to those living and working in the area. This Freedom of Information filing cited public reporting that indicated the existence of memorandums, studies, assessments, and other written documents indicating the Giuliani and Bloomberg administrations evaluated the extent of the threat posed by 9/11 in the months and years following the attacks. Despite the citation of public reporting in the Freedom of Information request, at that time and until very recently, the city's Department of Environmental Protection and the Emergency Management, those are both two city agencies, both responded that they had no responsive documents. Simultaneously, however, a representative from City Hall said the Freedom of Information request could not be fulfilled because of the difficulty assessing privileged material and liability risk. Those two statements are not the same. In November of 2024, the Corporation Council filed a motion seeking to dismiss the information request, citing the findings of no responsive records. For years, members of the New York City's congressional delegation have sought information from city government regarding what agencies knew about health hazards in Lower Manhattan in the aftermath of the 9/11 attacks. In 2021, Congress members Carolyn Maloney and Congress member Gerald Nadler sent a letter to the then de Blasio administration seeking the same information requested by the 9/11 Health Watch. They received no documents in response, leading Congressman Nadler and now Representative Dan Goldman to send similar requests to the Adams administration in both 23 and 24. This year, 2025, I proudly passed a bill to finally reveal the records. The heroes and victims of 9/11 who are suffering terrible and sometimes lethal medical problems are deeply interested in what the city knew about the hazards of that period and when exactly they knew it. We actually found a wonderful loophole in the city charter. It's great to find loopholes in the city charter. And what the loophole said is, as a member of the city council, I can request and the council can pass ordering the Department of Investigation, which I oversee as chair of Oversight and Investigations Committee. We can order the DOI to do a study. And that's the first time this city charter has ever been used in this way. So we hope it works. We have great confidence in the commissioner of DOI. The bill directs the city's Department of Investigation to ascertain the knowledge possessed by the Giuliani and Bloomberg mayoral administrations on environmental and toxins produced by the 9/11/2001 terrorist attacks and issue a report on its findings to the city council within 2 years. I have 4 more years on the city council, so they better well come up with it in 2 years. The report must contain an assessment of the knowledge mayoral administrations possessed, including the types of toxins, the length of time the toxins were expected to remain in the environment, and the immediate and long-term health impacts of human exposure to these toxins. The report will also include an analysis of the contrast between the knowledge mayoral administrations possessed on these toxins and the information the administrations conveyed to the public about satisfactory air quality in Lower Manhattan and Western Brooklyn. The point of this is not just to get the information, which is important, but also to say, God forbid something like this happens in the future, how we should approach it as a city. The remaining residents and survivors of the attacks are deeply interested in what the city knew about the hazards of that period and when exactly they knew it. I know the findings will be interest to everyone here in the audience. I want to say as borough president, I also had it was very challenging. Because we were located at 1 Center Street, which is actually where I think some of my colleagues were during 9/11 aftermath and died. I have 2 colleagues who died who were working with me. You never know for sure, but they had cancers that were very unusual. So I say all of this because I think that there are certain aspects that we need to make sure happen. The fight for truth after 9/11 is the same fight as today's movement for asbestos prevention. Both demand that we acknowledge science even when it is inconvenient. Both require putting human health before corporate profits or bureaucratic liability. And both insist that no community should ever again be told that toxic air is safe. That's why I fully support a federal ban on asbestos. The Alan Reinstein Ban Asbestos Now Act, named in honor of Linda's late husband, is not simply legislation. It is hope, it is life-saving, it is justice, and I hope what we're doing locally will also push for that. New York City must lead by example. We must strengthen asbestos abatement enforcement in housing, in schools, and in construction in particular. We must guarantee transparency in environmental monitoring after disasters. We must stand with communities worldwide in their efforts to ban asbestos once and for all. I certainly want to join you in your commitments to fight for full transparency. I hope you'll work with us about what the city knew concerning toxins after 9/11, to push for robust prevention because every exposure today could mean a diagnosis tomorrow, to partner with advocates like you, and thank you all for being here today, because the government cannot do this work alone. If it wasn't for the Health Watch, we would not have passed the 9/11 bill that I did pass. That is advocacy. It's your voices, it's your stories, and it's your vigilance to create change. Asbestos is never safe at any level, and silence is never an option. Thank you very, very much.